people join us for their lunch hour. Happy July, happy Sarcoma Awareness Month. It's nice to be together. Thank you for everybody who came together for Survivors Day in June. We had 2 celebrations and it was a wonderful event. So thank you for that. And maybe I should say I'm Carlin. So nice to see you for those whom I haven't met. Please save the date for September 17th. It's a Wednesday. Sue's Gift and Live by Living and the coalition are coming together in Pueblo for lunch and a walk. So there'll be more information in the timely task force updates about that. Please take a moment to click on the link that Ella's going to post in the chat about the cancer plan and about input for the cancer plan. We are working on revising the 2026 to 2030 cancer plan. It's an exciting time. This is a lot of work, as many of you know who've been involved in it in the past. And this year, the focus has been on quantifying concepts and being able to measure them and track them and show improvement. So we will absolutely make sure that you have ample time to provide feedback and that we're doing all the right things. But the ask right now is if you could at least click on the Google Forms link in the page and share your thoughts. And then please save October 1st. We're going to all come together for the annual symposium. It's exciting. There are many amazing speakers who have agreed to join us, and we should be hearing more about this. It'll be Wednesday, the 1st of October in Aurora, but I think we've asked about Zoom and virtual connections, so definitely more to come, but it's an exciting time for us to come together and connect with our colleagues from the state. And then I think with that, I'll just ask you to put your name and your organization and your email in the chat. And if you have items to share for the timely task force updates, please email us. They're gonna assume a new appearance, probably August of this year, September of this year. So I'm excited for the new format. But in the next timely task force update, you'll see something from Intermountain Health about their survivorship series. They're meeting the 3rd Thursday of each month at 6 o'clock in the evening in Red Rocks Medical Center, having different topics. So Sam in July is going to talk about survivorship, and then the YMCA team is going to talk in August. So that's exciting. And I think it's a perfect segue to turn it over to Krista. So Krista, the floor is yours.
Well, thank you. I just want to welcome Jessica Griffin from the YMCA. And Jessica, is it just you, not Amy also?
Amy will be here. She is just finishing up a class. So
Okay.
she'll hop on ASAP.
Okay, as long as that works for you.
Yep.
Jessica and Amy are going to talk a little bit about their program at the YMCA. And so I will let you introduce yourself. And then if you want to share your screen, Ella, did we give permission? Is Ella on here?
I just sent a request.
Just gave permission.
And it looks like I'm good. Yeah.
Okay, perfect.
Well, let me pull up my slides and then I will introduce myself. And I just want to confirm, I think we said we had about 10 minutes to present. Is that still?
You have actually up to the next really 35 minutes, but
okay.
We look forward to hearing about what you've got.
Awesome. And I always like to leave time for like discussion and questions. So just know that there will be time to have a conversation. Okay. Let's see. Can you see my slides?
We can.
Okay, let me find, I always forget where the slides show. Okay, how's that look to everybody? Okay, Chris, does that, you can see? Okay, great. So my colleague Amy will be hopping on at some point. And so I'll just introduce her. Amy Sagendorf is my counterpart here at the Denver Metro YMCA and oversees our programs in our evidence-based program suite. And then my name is Jess, and I am our senior director. I oversee all of our efforts in the public health space. And if you're thinking, wow, YMCA and public health, I didn't know that those two went hand in hand. And I'm going to just give you a little bit of context in case you only think of the YMCA as your go-to summer camp or swim lessons facility. And so I put my email in the chat, and if anyone wants to reach out, feel free. Okay, let's see. Get my slide to advance. Okay, so again, you might think of the YMCA as a gym or an aquatic center, but we're more than that. Our cause is to strengthen communities. And so we do this through the 3 area focuses that you'll see here: youth development, healthy living, and social responsibility. And as an association here in Denver and across the nation, we have been on a journey to strengthen our public health capabilities over the past several years. So our strategies for doing this, we've kind of been trying to look at whole person health. And so as you can see on this image here, our biggest contributors to health outcomes reside in those social determinants of health, whether it's the physical environment where people are living, whether it's their health behaviors. This would include those diet and fitness choices, as well as tobacco use, et cetera. The socioeconomic factors, education, job status, family support, safety within the community, and then again, health access and quality. And so the YMCA has worked over the past 15 years to address what role we can play as a community-based organization in leveraging the value of community to improve health outcomes. And typically the Y is a well-recognized brand in the community. People know us. We've been around a while. Even if you don't know us, you at least have maybe heard of the YMCA song. But we are typically a space where people feel comfortable if they don't feel comfortable in other settings to address some of these health behaviors and barriers. And so this is just to give you a little glimpse into our framework. It's a little busy here. Let's see if there's, yeah, here's our arrows. So the YMCA of the USA, which is our parent organization across the United States, we have been addressing chronic disease in new and innovative ways. We became engaged in disease prevention and management through implementation of several evidence-based programming and policy systems and environmental changes. And so, you know, we partner with many organizations here in Denver as your local Y association. We partner with other community-based organizations doing chronic disease management and prevention, as well as healthcare systems and organizations like you all. So when we think about how we actually operationalize this, I like to call it prescribe the Y. And so when we meet with healthcare and clinical spaces, we're really trying to encourage those clinicians to see us as an ally and as an extension of what can happen in the healthcare setting. We know that when you're meeting with a doctor, you don't have all the time in the world, and we want our clinical partners to know that we are an extension of that primary care setting, and we can kind of help with some of those behavior change programs or chronic disease management. And so these are listed, some of our programs that we provide here. And the one that we're going to focus on today is Live Strong. So we do offer diabetes prevention. That's a nationally recognized evidence-based program. We have a blood pressure hypertension management program. We call it BPSM, blood pressure self-monitoring. Again, Live Strong, which is for cancer survivors. We have a weight loss program. It's a 12-week class we call Lose to Win. I think it might be spelled wrong on my slide. Oh no, it's weight loss program. Phew. We've recently launched a community as medicine program, which is a group health coaching model for folks who have a variety of health conditions and health statuses. And it's really a way to practice some of these wellness-focused behaviors together in a group setting, as well as nutrition and health coaching. So really, my intention for sharing this with you all is just to help orient you to the fact that the Y is more than just a fitness center or a summer camp. We do a lot of things, and our public health initiatives is one that I'm very passionate about and so grateful to be a part of. And just want to make sure we highlight that so people know that we've got all of these great things going on. So these slides are the ones that Amy was going to cover. So I'll do my best. Amy is really the expert with our Live Strong program. And this is probably information that you all know like the back of your hand. But cancer survivors is an individual who's been diagnosed with cancer from the time of diagnosis throughout the remainder of their life. And we know that people are living longer after a cancer diagnosis because of all of the great advances in early detection and treatment. But we know that there's about 14 million people within the United States that are meeting this description of cancer survivorship. And so we know that physical activity has an important place in the cancer survivor journey. And we know that healthcare providers don't always have all of the resources at their disposal to be able to help navigate patients to kind of get back into being physically active. And we know that physical activity is important in many ways for many chronic diseases and conditions. And we also know that physical activity is not only safe and possible, but can drastically improve an individual's physical functioning and quality of life. So the Live Strong program at the YMCA is really meant to address the support in helping folks get back into being physically active in a safe and supportive way. So our program at the YMCA is for adults with a cancer diagnosis. It is a 12-week program. And during the 12 weeks, people will meet twice with a group led by a trained physical activity instructor. Usually these folks have a degree in personal training. So they're very, very well versed in physical activity with special training to deliver this program. It's open to all community members. You do not have to be a YMCA member. Participants will meet twice a week. Like I mentioned, the sessions are usually 70 to 85 minutes. And so it's a pretty, a good amount of time to kind of get together with the group and work together on the fitness and the physical activity skills that are being delivered during that session. And so the goals of Live Strong are to kind of regain that physical strength in a safe way. So building muscle mass and strength, looking at increasing flexibility, looking at functional ability. We always do assessments before the program begins, and then we usually see, where we want to focus on improvements, and then we do assessments at the end. Looking at reduction of treatment side effects, as well as improved energy levels, self-esteem, confidence. Okay. And so, our Live Strong program, again, is in our suite of evidence-based and evidence-informed programming. And so our program Impact in the orange box, we're very proud of. We know that this program helps survivors meet or exceed the recommendations for physical activity. We're seeing significant increases in cardiovascular endurance and function, and then just the improvement in quality of life, and a decrease in that cancer-related fatigue. So all really good program impacts and outcomes. We are one of many YMCAs delivering this program across the country. There are over 287 of us delivering Live Strong. And there's 42 states across our nation delivering this program. This is a testimonial from one of the participants who went through our program. You know, again, thinking about the YMCA as the place where your kids went swimming or the place that you went to summer camp, and not always knowing that there's this additional program and resource. You can kind of read her testimonial there. And then we've got one more here. I think this really goes to show how this program can be super supportive. This woman just finished our program at our Littleton location this year. She says that she's a 60-year-old woman who came to the program about 9 months after completing chemo. During that time, she had developed knee pain, neuropathy, decreased balance, and very minimal strength. She could hardly even open the simplest water bottle lid, let alone lift a heavy object. Because of the slow and well-considered variety of physical activities we were given, she felt reassured that the pace and rigor of the program were appropriate and was not intimidated to commit. And the 4 things that she mentioned are now dramatically improved. She's now at a fitness level that allows her to engage in all the activities she did prior to cancer, including long dog walks, vigorous gardening, regular yoga, and other exercise, and is confident enough now physically that she's going to Europe. So those are always positive outcomes and positive testimonials that we love hearing. My colleague Amy is back, so I'm going to let her log in so she can answer specific programmatic questions. She just needs a minute to log in, and I hope that I was able to get through those slides in a way that was informative. And I'll open it up now to conversation, questions, or anything else.
Thank you. That's great. I had no idea the public health piece of the Y. Do all Ys offer something like this? Do they all have a public health component? Do they pick and choose? How does that work?
You know, I can speak for our association. We, as the Denver Metro Y, have 6 locations across the Denver metro area. So we have a Littleton, Arvada, downtown, Aurora, Southeast Denver, which is our U Hills location. And I think I said them all. And so within our association, we deliver all of the evidence-based programs that I had in my slide about Prescribe the Y. We do have relationships with the other Ys across the state. For example, Pueblo is a Y that is starting to get capacity to deliver diabetes prevention, but they're not quite there yet. And so we kind of support them in that. With Live Strong is an in-person program. It's not something that we can offer virtually. So you do have to have the staff capacity at your Y to be able to deliver that program. And so for us, we currently offer that program in 2 of our locations. We're currently training some more staff to be able to do this program, but we offer it at Littleton and Aurora and Arvada. Did that answer your question? Were you asking more about broadly across the US?
I mean, I think what's relevant is what's local to us. I was just, obviously
Yeah.
it's not in all states, so not everywhere offers
Yeah.
that. That's great. We did have one question. Katie says, Live by Living has been collaborating in SoCo with Travis Lerma. Is there a possibility of facilitating collaborations with otherwise Live Strong program? In fact, Katie, maybe if you want to expand on
Sure.
that.
Thank you.
Hi, Katie.
Hi. So we've had a really wonderful collaboration with Travis, who oversees the Live Strong program across the Colorado Springs wise.
Okay.
And so just like more of a, cross collaboration, if you will. So one of our leaders actually went through the program, and she's professionally a physical therapist. So she can talk to our participants on Hike about Live Strong, as well as speak to the participants in Live Strong about Live by Living. So it's a really nice collaboration, and I guess also similar alignment in terms of exercise, and of course nature's medicine for us, as well as social health. So I'm just wondering, and we can take this offline, but I would love to talk to others across Denver metro area, because we do offer walks, hikes across metro area. From the Springs, we're trying to get one started in Pueblo, all the way to Fort Collins right now.
Oh, that sounds amazing.
Yes.
So Katie, yes, absolutely. We would love to connect offline. And Amy Sagendorf, there she is. There's her face.
Hi, Amy.
Amy is the most directly involved with our staff and our delivery of this program. So she would be a fantastic resource for you to connect with, for sure.
Thank you. By the way, I've heard rave reviews about your program. You're on mute, Amy.
Well, I put in the chat there, I'm so sorry that I'm late coming to this. It sounds like Jess was able to give you a great overview of the program that we offer. Are there any more specific questions that I might be able to help anybody with?
I have a question.
Go, Leah.
Oh, perfect. And so I've social worker at Lutheran, and I do try to refer to you all. I think it's a fantastic program, and just especially when people want to focus on the fitness and stuff. But my question is, so I can give a little bit more information about how large are the class sizes, and do they fill up pretty quickly? That way, because sometimes people get a little deterred with other sorts of assistance where they say, "Oh, there's a wait list," or "I don't know if I can get in."
Yeah, that's a great question. We don't usually have a wait list, mostly because our referral process and the fact that we're kind of limited. It is an in-person program, so we have right now the 2 centers, hoping to add more. But our enrollment process, we've got a pretty great enrollment team. Excuse me. So if you have someone that's interested, please connect with us. Jess could give more specifics on, a clinical referral, or you can refer people to our website, and there's a phone number and an email that people can reach out, patients themselves.
Perfect.
Did that answer your question?
It does. And so just so I know, so who is so I think I heard 3 towns. So what are the 2 locations where the classes are offered? Is it Littleton? Is it Aurora or Arvada?
Aurora.
Okay.
Aurora and Littleton. We are hoping to bring the program to our Littleton location and our University Hills location. Excuse me. We have 2 staff members that are in the process of getting certified to be able to deliver this program, and we're excited, of course, to bring it to more locations. We're just not quite there yet.
Awesome. Well, thank you so much.
And I see that Jess just put more information in the chat on that.
Could you give us, go ahead.
Oh, sorry, Carlin. This is Jeanette, also from Lutheran. I was wondering if you guys have a place with a little more information about the weight loss program as well, and if it's geared towards something that cancer survivors or women's on the AIs or stuff would benefit from, because that seems to be a void for us, as well as being able to find a good weight loss program for our cancer survivors.
Yeah, that is a great question. The weight loss program that we deliver here through the YMCA, it's more of a behavior change program We do not prescribe any, diets. We don't prescribe exercise, but we do talk about and support people in both of those areas. It's really an opportunity over 12 weeks to get the support from a group and from a certified weight loss instructor to help support people in identifying what are some areas in their life surrounding perhaps food choices or being physically active, but also, stress levels, the wider holistic view of health, looking at those different areas and being supported in making changes and in setting goals for the weight loss program. So it's a behavior change program. And I think in that light, it really is appropriate for anyone. We've had people in the class that wanted to lose weight. We've had people that wanted to actually gain weight. And it's one of those programs that at any level you can engage and get something out of it.
Great, thank you.
You're welcome.
This is Katie again. Quick question just about your studies. Do you publish any of the outcomes, or how do you go about those types of things?
Right now, Jess, you might have to chime in here. Right now, the majority of our data collection is used to reinforce the need and the success of these programs. We use it primarily to, to ensure funding, continued funding to deliver the programs. We are not actively in the loop of research and gathering data and then publishing. It's more, as a nonprofit, we are more interested and concerned with, is this program effective? Is it targeting the areas and the outcomes that we're hoping that it does? And then are we delivering an effective program that is, eliciting the outcomes that we're hoping for? So it's quality. We're constantly trying to make sure that we are delivering quality programs.
Okay. Thank you.
And again, Jess is adding a lot of resources in the chat. Thank you,
I just
Jess.
put a link to one of the articles that's usually cited on the YUSA website.
Okay, that's great.
Did that answer your question? I'm not sure that I answered it.
Yeah, I mean, as nonprofits, we're always looking about how to best report outcomes, right? With limited resources and all of that. So totally get it. I just wondered if you had anything published. I will pull this off the website here or the chat. And then do you also track like integration into your other programs after Livestrong or Healthy Lifestyle, et cetera, after they go through your program?
Yeah, with one of the outcomes that we do track is, how are people that are finished with one of our programs, Livestrong being one, are they engaged in other health programs? As you can imagine, a lot of people in our health programs have multiple issues that they might be working with. For example, we've got again, I wasn't on the beginning of this call, so forgive me if I'm repeating what Jess has already shared, but we have our, the blood pressure program for people with hypertension. We have our diabetes prevention program. So, those are programs that, kind of go hand in hand. If somebody's in the diabetes prevention program and they screen positive for hypertension, then we can get them involved in the support of that program as well. And it's the same with the Livestrong program. We in that we have a great opportunity to, even though they are group cohorts that we're delivering and working within, we support our coaches in really getting to know the individuals in their classes. And even though, for example, coach might be delivering the Live Strong program, they're given the support to look at these individuals as human beings. And there's a lot of conversation where, other things, other health issues that people are trying to address come up. And we like our coaches to be sensitive to that so that we can give them the support in these other areas.
Thank you.
Mm-hmm.
We had a question about whether or not if there are any similar programs on the other side of the state, on the western slope and that direction.
Good question.
Because rural is always a challenge for servicemen.
Yeah. I am not aware of, specifically the Live Strong program, cancer survivor programs. I do know that our other programs, because we do offer those in a distance learning setting, that we're able to reach more of the rural, we're able to deliver in the rural settings. And we do in our diabetes prevention program. We have, a fair amount of outreach into the rural areas. A lot of times it's, the challenge is getting the word out. It's the awareness of it, right? We have these programs. We would love to bring them to as many people as we possibly can that could benefit from participation. I think a lot of times we could really use the help in that, connecting the dots, letting people in different areas know that these are available. Yeah, and I wish I had more information on the Live Strong Cancer Survivor Program support. It's a good question, and one that it's a good opportunity to look into that for sure.
This is Carlin. Could you tell us if you allow teenagers and young adults in your program? Do you offer programs or resources for people where Spanish is their primary language?
Yeah, great questions. So the majority of our health programs at the moment are for adults 18 and older. And we do offer the Live Strong program right now. We do not have a certified coach available that's able to deliver that in Spanish, but our other health programs we do. So the diabetes prevention program, the blood pressure program, the weight loss program, we have bilingual coaches that can serve that community as well.
Thank you. I think it's so timely to hear from our YMCA colleagues, especially with the wonderful Survivor Day in Colorado Springs, and then the article that was just published in the New England Journal of Medicine talking about structured exercise programs actually improving outcomes in people diagnosed with colon cancer. So I think that, those of us who are health care providers, nurses, social workers, APPs, MDs, counselors, like we all have a role and a responsibility to let people know that moving their body will help them do better.
Yeah, I love that. That's a great reminder that movement can help in so many different ways.
Can I ask a little bit just about funding? And, are you guys at risk for losing grant funding, kind of given the current climate, or are you kind of good to go?
Krista, that's a great question. Right now, we have a variety of different funding for the different programs. We have a really wonderful grant from our CDPHE from our state, who has always been so supportive for our diabetes prevention program and our blood pressure program. As far as we know, we have funding for this next fiscal year. Jess, do you want to talk about funding for any of the other programs?
Livestrong has traditionally been part of just fundraising. And so we continue to operate without a clear budget on Livestrong. Like we will not, our CEO has been very clear that we're not going to stop doing the program. But we've got, a strong development team that's always out there trying to find support. We do, if someone takes the program again, which a lot of people repeat the program, they'll take it a few times. They will self-pay after the first time they've gone through it at no cost. And we're just committed. So, it's funding is always a challenge. And I think for right now, we're just we're looking forward. We're doing what we need to do until we have a roadblock.
Thanks. I know that's a loaded question, but I
Totally
wanted to make sure we weren't sending people somewhere where, you guys were really struggling to keep it going. Anyone else have any other questions? I think this has been great information. We have about 20 more minutes, and I wanted to invite our other groups to let us know kind of what you're doing this summer, share some of your programs, maybe with Jessica and Amy. So we've got those connections. Let us know if you've got something interesting happening. I know Carlin wants you to send it towards the Timely Task Force update, but if you want to share it with us now, we would love to hear it.
I can share. This is Katie. So I'm with Live by Living, and this summer we have a number of programs that we are facilitating, from walks and hikes everywhere from Pueblo to Fort Collins. We have a program in Durango, a program in Iowa. At this point, we're trying to get one started in Pueblo. And I just want to echo the invitation that Carla sent out to our event down in Pueblo on September 17th. It's really just a matter of health systems, nonprofits coming together to provide a walk and a lunch for cancer survivors and caregivers. We also are doing a Cancer to 14K program, which is a progressively more challenging hikes across 10 weeks that culminate in a 14er or 14,000 steps. So that's in progress. And then we have probably 4 more retreats, mountain retreats, 2 nights, 3 days, either at the YMCA in Deckers or up in Snow Mountain Ranch. And then there's a couples retreat. And I just want to reiterate that all our programs are free of charge, both for cancer survivors and caregivers. So it's a little bit of a differentiation from other programs. So if you have any questions, I don't want to take too much time, but I'm happy to speak to anybody offline.
Thank you.
Thank you.
I can go. Hi, this is Christy Cahill. I'm with CC Insights and helping with the Colorado Kids Cancer Association, and they're hosting a resource fair on September 11th at Children's. We realized through the pandemic that a lot of organizations closed down that had been helping peds and AYA populations, and people just didn't know what all is still out there. And so for not only letting the clinicians at Children's know, also just for the orgs to get to know each other again. So we're doing that September 11th from 10 to 2.
It's a great idea, and I think will be really valuable. Jeanette, do you want to take a minute and tell us what you guys have going on? I see you're not muted, so I'm putting you on the spot.
Oh, sure. It's kind of a new initiative for us. Our regular support groups, especially for non-breast cancer patients, that kind of waxed and waned here. So we've decided to focus on survivorship. So we're going to do a monthly survivorship. We're really trying to avoid calling it support group, more of an educational place where survivors can learn a little bit about healthy survivorship and then have the opportunity to talk with other survivors. So we have that list of different topics through February 2026, and we'll see how it goes. And we're trying to get back to in-person things rather than offering a hybrid option. So fingers crossed.
Thank you.
Thank you. And please feel free to send your any survivors you guys have at your locations to the group. It's not exclusive to our patients.
Hi, my name is Christy. I just want to introduce myself, first time on this call. I'm the director of a nonprofit called Project Soulflower, and we grant bucket list dreams for 18 to 26-year-olds who are facing a life-altering or life-threatening illness. A lot of our dreamers are cancer patients. So we're also working with CKCA with Christy Cahill. So I'm here representing that group as well a little bit. Just wanted to share our program with everyone and let you know we're here, and we're happy to hear about Live Strong. That's a great program.
Awesome. Anyone else want to chime in? Carlin, anything else we want to cover, or are we going to give people back 15 minutes?
Let's give people back 15 minutes. We'll post Jess's slides and any resources she gives, and welcome to all of those who took time to join us, and be safe this summer. Wear your sunscreen.
Thanks,
Thanks,
everyone.
Carlin.